Okay, good morning, everyone, and thanks for joining us for QI Power Hour. This is Caroline Beck with the Saskatchewan Health Quality Council. So thanks to everyone who has joined us today virtually from locations all across our province, and for some of you all across Canada. As we begin our session, we'd just like to take a quick moment to acknowledge that Health Quality Council is located on Treaty 6 territory in the traditional land of the Dakota, Lakota, Nakota, and homeland of the Métis. And I myself actually am joining today from Treaty 4 territory, the original lands of the Cree, Ojibwe, Saulteaux, Dakota, Nakota, Lakota, and homeland of the Métis. As an organization, we are committed to learning from the history of this land that we call home and to move forward together towards better health for all people of Saskatchewan. So we invite all of you to take a quick moment to also consider the land that you're joining us from here today, and then the intentions that we each have individually and collectively to create meaningful change where we live. For those of you who are joining QI Power Hour for the first time, this is a free monthly webinar learning series hosted by the Health Quality Council here in Saskatchewan. We bring together improvers from a variety of sectors with an interest in improving health and to learn about quality improvement related topics. All of our sessions are recorded and available on the HQC website following the event. So feel free to share these recordings with colleagues who were unable to join us here today, and feel free to check out some past sessions that you may have missed. While you're on our HQC website, we also invite you to sign up for our distribution list to ensure that you receive regular invites to all of our upcoming QI Power Hour sessions. We're actually so excited because today is our 30th QI Power Hour session. And over these past 30 sessions, we've seen continued growth of QI Power Hour throughout our home province here in Saskatchewan, across Canada, and even abroad. So thanks for spending an hour of your time with us here today and for your commitment to ongoing learning to improve the systems that you are each a part of. We're looking forward to your engagement and participation on the webinar today, and we encourage you to share your questions and your insights during today's session by making use of the chat function. So if you haven't already located it, you can access the chat function by clicking on the message bubble towards the bottom of your screen, and this will launch the chat panel on the right side of your screen. We encourage you to share your questions and your comments and your ideas throughout the session today, but we'll have some time dedicated to questions and answers at the end of the session. Please make sure that you send your questions and comments to all participants so that we can all join in on the discussion. So we'll take a quick moment just to practice this function by typing in the chat the name of the organization that you're joining us from here today. So good morning from Saskatoon, our home folks located in Saskatoon at HQC's headquarters. Some folks from the Saskatchewan Ministry of Health, Saskatchewan Health Authority, a couple folks from those different places. Awesome, it looks like everybody's getting the hang of it. So thanks so much for joining us here today and for participating in the session. Throughout the session, we also invite you to tweet about your insights and your reflections. You can use the hashtags QI Power Hour and Citizen Science and the handles HQC Sask and Tarun Katapally. So with that, we'll dive into our session. I'm delighted to welcome our presenter for today. Dr. Tarun Katapally is an associate professor and patient-oriented research leader at the Johnson Choyama Graduate School of Public Policy at the University of Regina. He established the Digital Epidemiology and Population Health Laboratory in 2017, which implements the SMART platform developed by combining concepts of citizen science, community-based participatory research, and system science. He is also the country leader for India for the development of global report cards on physical activity for children and youth. During today's session, Tarun will be talking about citizen science and public health policy and how this approach has leveraged the power of ubiquitous tools to support population health. So with that, welcome Tarun, and thank you for joining us for today's QI Power Hour session. I'll turn it over to you.
Thank you, Caroline. Before I start the session, I'll take this opportunity to actually thank everyone at HQC who made this possible. I took the time to actually put this QI Power Hour together. And Caroline, I'm not able to move my slides. So,
okay, I think I just passed you the ball. Is the toolbar?
Got it now. All right. So the title of this session is Citizen Science and Public Health Policy and Leveraging the Power of Ubiquitous Tools. And this might seem like jargon to many, but I actually chose this for a particular purpose because I wanted the topic to overlap population health, epidemiology, public health, health policy, and even healthcare policy. And I know quite a few of you are what in academia what we call our policy and practitioner stakeholders. So the idea of this talk was to not make it academic, but make it more about applied research. And as I go through my slides today, as I'm talking through my slides, I would want you to think about how you could use citizen science in your day-to-day work. And funnily enough, this morning I realized, I thought about attention spans because this is a one-way thing. It's a webinar. Apparently, our current attention span is at 8 seconds. So hopefully you'll have the attention for at least 30 minutes, and I'll try to keep it as short as possible so that we would have enough time for questions. So the other thing about ubiquitous tools, when you think about ubiquitous tools, the simplest thing to do is think about what you have in your hands every day. It's your smartphone. So that's what we're talking about, ubiquitous tools. So to put the talk in context, we wanted to do a simple poll of 3 questions. And I would want you to answer the polls, and I would talk about them once the polls close. You would have about 5 to 10 seconds. So I think you should be seeing the first one right about now, and just take a guess and pick which one you think is the right answer here. And we'll be able to see the results in a few seconds. Well, interesting answers, actually. I'm not surprised by this, but only 16% of you got this right. So the number of smartphones by next year is expected to be 6 billion, which is pretty crazy, come to think of it. And I'm not surprised by these results, but even though we use them on a day-to-day basis, we don't realize the market penetration. And in this case, the technologies sometimes is driving the research, and hopefully in the future, the research will drive the tech. So we'll go on to the second question now. So here's the second question. When you think about digital quotient, think about intelligence quotient. So I wanted to see what your perspective is about where we stand as a population. And the poll should close in a few seconds. And I guess the poll's closed now, and we'll be able to see the results. Right, interesting again. So 11% of you got this right. Apparently, we become most tech savvy as a population at the age of 14 years. So again, that provides a bit more context about who would be a prime participant when it comes to doing research using ubiquitous tools. And frankly, it does make me feel a bit old. It's 14 years is pretty young to peak when it comes to using technology. So we'll go to the final question, and then we'll move on to the talk. Here it is. Right. I find this really interesting because your answers have improved, and 29% of you got it right. It is true, according to Stats Canada, that statisticians we talk about numbers in terms of probability. You rarely see a number which is 100%, but apparently nearly 100% of our youth go online every day or own a smartphone. I know it's a double-barrel question, but this sets the stage for our talk today that we are surrounded by these ubiquitous tools. We connect with each other using these tools. In fact, our communication, our culture is even changing, and our behaviors are changing because of these tools. So the whole idea is, can we use these tools for the betterment of our communities to do better research? And I'm of the belief that yes, we can. And that led me to establish our lab, which is called the Digital Epidemiology and Population Health Lab at the Johnson Sharma Graduate School in Public Policy, which is based both at the University of Regina and University of Saskatchewan. Now, all the studies that we conduct through the lab are conducted through our platform, which is called the SMART platform, which is a citizen science and mobile health platform. And to my knowledge, from a population health perspective, this is the only platform that is using both citizen science and mobile health to address some of the issues we have in our communities. So every study that we do is being conducted through citizen-owned smartphones. So I would like you to picture that whatever study we do, whether it's for physical activity, obesity, mental health, from a health promotion perspective, from a population health perspective, we moved away from traditional sources of data collection and engagement, and we are engaging participants, or what we call citizen scientists, through their own devices. So what is citizen science? Citizen science, in one definition of it, is a participatory approach where participants, termed as citizen scientists, actively engage in the research process, from data collection to knowledge translation. And some of you out there might be thinking, how is this different from community-based participatory research or patient-oriented research? It's not very different. I think there are major overlaps between patient-oriented research and community-based participatory research and citizen science. I think what citizen science changes is the speed of engagement, or engaging with the participants directly in near real time. So in one way, it's community-based participatory research on steroids. When you think about citizen science, it could range from contribution, collaboration, co-creation. So when I think about contribution, it's more about providing data, and there ends the role of the citizen scientist. But it could be elevated to collaboration, where you could translate knowledge as a certain project goes forward, a program goes forward. And of course, similar to community-based participatory research, it could also be a co-creation, which is the highest form of engagement, where you engage with citizen scientists from the get-go in conceptualizing research questions, in identifying problems in communities, in developing design, and even analyzing data together. So it all depends on what kind of problems you're addressing, what kind of research questions you're asking, and the citizen science could range from contribution, collaboration, and co-creation. Now, as I said, there's serious intersection between citizen science and patient-oriented research and community-based participatory research. But there's also an overlap between system science, which leads us into computational modeling and simulation modeling. And this intersection comes because of the big data, as we call it. We collect big data using these ubiquitous tools. So when you think about citizen science, just do think about patient-oriented research, do think about community-based participatory research, but also think about big data. So as I'm talking about this, maybe some of you are thinking, is this just theory? So this led me to actually develop a framework called the SMART framework. And this figure basically provides a gist of that framework. And This is not in my mind, this is not a theoretical framework. This is an evidence-based framework, and the framework was developed based on the evidence we generated over the past 3 years. So as you can see, the symbol itself is an infinity symbol that explains the constant data flow and how the data changes into evidence and how it changes into knowledge and then back into evidence. And the policymakers and the communities and the citizens are on one side. There is co-creation, contribution, and collaboration on one side, and the other side is related to data mobilization, management, and modeling. And of course, being an academic, in my mind, I see us being the central node. You might see it differently, but this is a framework that was actually published this year in a high-impact journal called JMIR, mHealth, and uHealth. And you should be getting a link in your chat boxes now. You can read the whole article if you're interested and if you have the time. So this is moved beyond just theory. This is an evidence-based framework that we're using to conduct all research. So what is driving citizen science in the digital age? Of course, the answer is the penetration of smartphones. And when I think about citizen science, I'm thinking about citizen science in terms of digital epidemiology, in terms of digital interventions, where we have the capability to reach out to almost 90% of the population because of the devices they own. So the growth of citizen science has been in parallel with the growth of smartphones. And interestingly speaking, I talk about smartphones a lot, but I'm not funded by any smartphone company or even a telecom company. It's just a reality that we have to work with these tools. We have them. We have to use them effectively. So what can citizen science do for us? I think first, it can address our data gaps. We have immense data gaps, as you can see from the screen grab. This was an article published earlier this year, and it identified data gaps even beyond the health sector, in education, in justice, in social services. And I think citizen science has a role to play in addressing these data gaps because we can directly interact with citizens in obtaining data. So that's the first thing that comes to my mind, right, in everyone's mind when you think about obtaining data. It's addressing the data gaps. The second thing is addressing health inequities. Because of the penetration of these devices, we can even engage with participants who are quite isolated. Think about people living in northern communities. Think about unreserved communities in the north, and think about youth who you might think are pretty isolated geographically, but they own these devices. And there is a way to interact with them in near real time. So that's one example of addressing health inequities. You can think about improving adherence in someone taking HIV medication. You can think upstream or downstream, but there is potential to address health inequities by engaging with patients, citizen scientists, participants, subjects. You might call them whatever you want, but the approach that could help this is citizen science. Finally, this could be beyond the scope of most health research, but misinformation and disinformation is a big issue these days in a politically charged world. And I think citizen science has a role to play in doing that as well. And from a population health perspective, where we don't limit ourselves to just health and healthcare, where we work in other sectors such as education, justice, and social services, I think citizen science could play a role in even addressing misinformation and disinformation. So, top 3 points. This is what citizen science can do, but how are we obtaining these data? I think for the most part, we are obtaining these data using third-party services such as Google, Facebook, Twitter. I know that Google and Facebook are pretty closed, but Twitter opens up its data, and you can do a lot of analyses using these secondary data. One thing you got to recognize is that most of the data that are obtained through third-party services doesn't deal with informed consent. We are not consenting in the utilization of these data. We are using these services, and the people who own these third-party platforms are using our data. And there are immense ethical implications, issues in terms of loss of anonymity when you use third-party services. So our approach has been direct engagement. And how do you engage with participants directly? Through eHealth platforms, to mHealth platforms, and uHealth platforms. Now, most of you might be aware of eHealth platforms when we talk about digital data. But mHealth platforms is a world that we work in because, again, because of the maximum penetration of mobile phones, and that's the sweet spot for us. When it comes to uHealth, you're thinking about other ubiquitous devices such as smartwatches and devices that people carry, and these do not have the same penetration as smartphones do, but we can still leverage them and we can still use them for direct engagement. So I'm talking about direct engagement, but why should people become citizen scientists? And why should people provide us their data? Now, from an epidemiological perspective, some clinicians might argue that there is a duty to provide data if it's for the betterment of the population, for the communities. But when we think about digital epidemiology, when we think about citizen science using digital devices, we are talking about really sensitive data, people's movement patterns, location patterns. So why should anyone provide their data to us? So I think there could be some instances, and this has been discussed in the world of digital epidemiology, that if there is strong interest in reducing a certain disease in a population, people might provide data. And if there is less burden on the participant, and if there is lower risk, people might provide data. They might even provide data if you convince them that you'll not use personally identifiable data. But these are real challenges when you're working from a health promotion perspective, because the benefits could, or a population health perspective, because the benefits could be 10 years from now or 5 years from now. So how do you convince people to provide data? Another option could be providing them citizen and community voices. So empowerment is an approach. And that works up to some extent if people are motivated enough. Reciprocity is providing some incentive. So this could range from monetary to actually doing something for their community, for them participating in your study or providing data. Data ownership. The tech savvy amongst us might want to own the data that they're providing. That's another reason why people might provide their data. Finally, if you translate knowledge that participants might use themselves, or communities might use themselves. So these are the potential reasons why people might provide data. And in our experience of working in this area, there's no simple answer. Sometimes you have to use almost all these strategies to engage people. But how did we learn about how to obtain data? And we had to actually start from scratch and lay the foundation by testing, piloting, and implementing our smart platform. And what you see on the screen is another manuscript we published last year, which details the methodology of this platform. And we picked one aspect, we picked one problem, which is active living, to understand why people would provide us data, what are the compliance issues, what are the ethical issues, how can we retain participants over a longer period of time, how can we engage them in near real time, at the same time protect their anonymity. So there was a real thought process behind the knowledge that we've developed in the past 2 or 3 years. So as I'm talking about this, this is not theory. This is actually real evidence at this point of time. So my approach to this is, local solutions to global problems, and not global solutions to local problems. Whether you think about anything as higher up as climate change, or something in between as obesity or mental health, or even something downstream such as adherence to a treatment protocol, I think through citizen science we could have local solutions to these global problems which we all face. And in a globalized world, global problems have become local problems. It's a bit of a conundrum. And what you see on the screen here is a screen grab of our citizen scientists across Canada who engaged with us. So that's the approach we are taking to addressing some of the provincial, federal, or even global priorities. Recently, WHO has come up with guidelines for digital health interventions, and these guidelines are actually quite effective, not just in developed, as you would call the developed West, but also the developing countries, again, because of the immense penetration of smartphones in the developing world, where in some countries, people might own not just one, but 2 or 3 phones. So we are working, we are thinking about population health and epidemiology in this digital world. And I think there is a need to move beyond traditional approaches in how we engage with participants. And citizen science is one way. So I mentioned big data in the past, a few minutes ago. And when I think about big data, it's not just about volume, but it's also about the speed at which we get data. That's the velocity. And when you think about timestamp data that you can get in real time when you're engaging participants through their smartphones, that's where the big data lies. So there's volume, there's velocity, but there's also variety. This screen grab shows you a typical citizen scientist data that we obtain. And as you can see on the left side, you've got a range of sensors that sense data from participants in different jurisdictions. So that's a sensor-based objective data. But we also obtain subjective quantitative data by pushing questions in near real time. We get qualitative data in terms of pictures, audio files, video files, and we have different survey triggering mechanisms that could be triggered based on someone's location, based on the time of the day. And we also have paradata, that is data that could be used for improving compliance. For example, how long does it take for a participant to answer a certain question? What is the battery life of a certain participant based on the time they spend on a certain app? So as I'm talking about this, you might be thinking, this is extremely sensitive data, and we need to have strong protocols, strong ethical protocols when we engage participants, and that's true, and that's something that I'm going to talk about in a minute. So when you think big data, I think my mind at least goes towards systems mapping and dynamic modeling. And you might have seen this obesity map in the past. And as we collect data, I'm not just thinking in terms of building such a large map, but even if you take a small portion of it, if you in your day-to-day world, if you are addressing a problem, you could potentially build a small systems map using the data that you can get from smartphones by engaging citizens in near real time. So how are we actually conducting citizen science? And I talked a lot about the ethical implications. The first thing is ethical surveillance. And we are doing this via international implementation. At the moment, we are running a study called Smart India, where participants in India are engaging with us and providing their data in near real time. And how are we doing this? By obtaining informed consent, where participants can actually drop out anytime they want. They can potentially engage with us if they have any concerns. More importantly, we are also figuring out how to obtain data and move data across international jurisdictions. So there are several things happening in this world as we are using citizen science for ethical surveillance. Second thing is, back home, design, delivery, and evaluation of population health interventions. A good example of this is a current study, a community trial we are conducting on youth in unpreserved schools, where we have embedded a land-based active living intervention into the school curricula, and the youth are engaging with us using their smartphones so that we get youth perceptions in near real time. The ultimate goal of this study is to minimize poor mental health outcomes, especially anxiety and depression symptoms. And the last one would be responding to existing and emerging population crises in near real time. Now, we are currently exploring ways to potentially develop a platform to engage with youth, especially in rural and remote areas, to address their anxiety and depression symptoms in near real time. And as you can imagine, there are several logistical constraints, ethical constraints, liability constraints, and that's the interesting bit, because I think the tech has moved away and it's advanced, but we are restricted because we don't have enough guidelines to do the work that we want to do, and that's the area that we are working in at the moment. So, in my mind, I think we need a citizen science policy, a national or provincial citizen science policy. And what can a national or provincial citizen science policy achieve? Now, I think we need to enable funding mechanisms for citizen science collaborations. And I can't emphasize the importance of this because according to current evidence, there are 2 million citizen scientists across the world who provide their data. Sure, it's not for population health, it's more for environmental research, but there is a big opportunity for population health to benefit from citizen scientists. And current estimates kind of measure up to $2.5 billion in terms of the time the potential citizen scientists invest on a yearly basis in providing us data. That's a free resource that population health science is not using at the moment. So we need effective funding mechanisms for citizen science collaborations. Second is devise educational campaigns to increase public engagement. I think most people in the population health realm are not using citizen science, and I think there is a need to not just educate the general public, but also discuss citizen science as a legitimate approach in population health research. Now, develop guidelines for data ownership and data sharing. Who owns the data? When we establish collaborations with communities, we discussed this right at the beginning. We discussed data sharing mechanisms because that's the most important thing, and that improves compliance, that improves motivation and drive. Addressing internet inequity, and this is a huge thing. And in my mind, the definition of internet inequity is variation in access to internet based on someone's geographic location, someone's age, or even gender. And we know that currently there are huge gaps in terms of internet connectivity, especially in the north. I think the federal government in the previous budget came up with a plan where they want to provide internet connectivity to all Canadians by the year 2030. It's a step in the right direction, but some countries are doing better than we are. We try to manage internet inequity at a community level. For example, at a school level, we try to engage with our principals that we are working with to provide youth with more access to Wi-Fi during after-school hours, for example. That's the way we are addressing it. Finally, to facilitate intuitive front-end interfaces and back-end data linkages. Now, there are 1 million applications out there. Why should anyone use your application? And I think we should develop better front-end applications. How can we gamify a survey? How can we engage people more effectively at the front end? And at the back end, how can we link data more effectively? We tend to work in silos, and I think it would be a wonderful opportunity if all stakeholders in academia could at least do one small project where they could connect population-level behavioral data obtained through citizen-owned smartphones with downstream data. And I think that's the way forward when you think about improving the effectiveness of citizen science in public health policy. So one takeaway I'll leave today is, we've mentioned a number of things. Some of the things that I've mentioned might be pure jargon, but one takeaway is do consider citizen science when you think evidence-based policy, because in some ways this evidence through citizen science is potentially coming from, theoretically speaking, in my philosophy, it's coming from potential voters and not from an academic like me. So that's where I'll end the session. Thank you so much for joining us today, and I'll be happy to answer any questions you might have.
Thank you so much, Tarun, for such a thought-provoking session this morning. In particular, I love the idea that you shared around having local solutions to global problems and not the other way around. I wrote that down for myself as a reminder to keep in my own head. So we'll have some time now to turn over to you, the participants, and discuss the questions that you have for Tarun. So I'll keep my eyes here on the chat, and please feel free to send those in to us now. But I'll get the ball rolling here. I have some questions of my own that I've written down. I'm really interested in this idea that you discussed around using citizen science to reduce health inequities, and I know you shared a couple of examples of some of the work that's happening already. Can you tell us a little bit more about how you see that playing out, either things that are going on already or some areas that you'd like to see citizen science move into the future as this work continues to evolve?
It's a great question. I think towards the end of the talk, I talked about internet inequity, and I think with the UN declaring that internet is a human right, at a structural level, at a higher level, we need to figure out a way to minimize internet inequity to minimize health inequities now. And some of it is beyond the scope of academia, but it's something to be talked about. So I don't see us minimizing health inequities in this day and age if we don't minimize internet inequities. But it's not a cop-out answer. The work that's already happening is purely dependent on ownership of these devices. And in an ideal world, almost everyone we are working with owns these devices, from youth 13 and above. So our challenge in minimizing health inequities at times is coming up with ways to keep them in a certain project that we are working in. How can we motivate them into working with us? And I'll use the example of mental health right here. Imagine youth in rural and remote areas, and geographically they are very isolated, but they have this device that connects them to the world. And but the same device could be quite detrimental. In my idea, could we use it to do some good? And I think we could, but we have to embed the citizen science approach in community-based participatory research. For us to engage with that population, we need to develop relationships with the communities so that the youth actually work with us and actually are on a certain app we want them to use. The simple way to do this is to work with the schools, to engage them in a certain program, and to figure out a way to identify and detect early some of the issues that we might see, such as anxiety and depression symptoms, but at the same time come up with ways to addressing them, but addressing them in such a way that the solutions are geographically and culturally appropriate and specific. Keeping in mind that if I take this example of mental health, keeping in mind to not cause any micro traumas. Now, I don't know if that answered your question, but it's quite complex and it takes a lot of careful thinking and piloting and testing.
For sure. Lots to think about in implementing these types of new approaches. And of course, we're living in an ever-changing world, so it only becomes more complicated. We do have a question that's rolled in through the chat here, asking about whether you're finding there's any participation bias in terms of the people using the applications.
That's a question I always get in terms of participation or self-selection bias. And I think that's why there are two different things here. Yes, you can crowdsource, and if you crowdsource, you potentially will have some selection bias. People who are more motivated will participate in your studies. And I think crowdsourcing does work up to some extent when you're trying to address some community issues. So, for example, we can crowdsource to understand barriers and facilitators to our physical activity or active living. What are the barriers in our urban environment? And I would be less worried about participation bias there. But when you think about engaging large populations, for example, my go-to is the youth population. And we've managed to engage almost all youth in Regina schools, high schools. So our way to address any participation bias is to engage as many, almost the entire population that we are working with. Now, that's not always feasible, but that's the approach we're taking, especially with the youth. So it's kind of tricky at times, but we get around by trying to recruit almost an entire population.
Oh, that's great. So we have another question coming in here. What are the most unique ethical considerations when you're applying to do a citizen science study?
Oh, unique ethical considerations. Convincing potential citizen science that they won't be tracked in real time. And because if someone's using their smartphone and they are providing us access to their GPS, there is a potential that someone could be tracked in real time and near real time. We don't do that for sure. So we have clear informed consent to detail the kind of data analyses we do. But at the same time, we could retrospectively figure out the locations of participants for our own analyses, whatever study you're working on. So retrospectively speaking, you can actually understand detailed patterns of someone's movement. So a unique ethical consideration is coming up with rigorous anonymization approaches so that it's difficult to go back and drill down to finding out who the exact participant is. That's a unique challenge because a lot of people are worried about that kind of thing, especially when you're talking about parents and getting data from children and youth. So we've had some challenges, and the way we've addressed these challenges are to first engage with the community that we are working with and make it clear make it clear about the data we are collecting and the kind of data we are collecting. So an example here would be if you're engaging with youth between 13 to 18 years. The first step is to get parental consent, and this parental consent is obtained via the schools. And after we obtain parental consent, we obtain youth assent or informed consent. So that's a very unique issue here. But if someone is participating in a study and they're using their smartphones, you're getting prospective data. And another constraint could be, their ability to negotiate how they want to participate in the study. So one way to address that is give them the opportunity to drop out anytime they want, delete their data anytime they want. So I hope this provides some context to some of the constraints we face in engaging citizens.
For sure, yes, it definitely speaks to a number of those privacy challenges that I think are ever present, I think, for a lot of people and in the minds of us as we're using our technology. I'm wondering if you could talk a little bit about what it's like in terms of the experience as a participant as a citizen science. So what does it look like? What does it feel like as someone who's actively participating in citizen science as a citizen scientist?
Oh, I don't know if I'll be able to give you an objective answer there, but when I've tested the studies, I found them quite interesting because they are my studies. But I think from a citizen's perspective, if you're talking about population health, sometimes it could seem a bit boring. And I think we lose participants because we don't have interesting data, interesting interfaces at the front end. So as a citizen, you'd have to be a bit motivated to participate in the study. That's a challenge. And I think one way we've had high retention is because we've managed to embed some of our community-based participatory approaches into our research. So for citizens, I think if you're engaging them and asking them to provide data over a period of 1 month, there's going to be high dropout. But if you're thinking about engaging them for 1 week and asking them maybe a couple of questions every day, I think it could be quite interesting, especially as a citizen. If I'm getting to see the data that I'm providing, if I'm able to see not just my data, but also anonymized group data, that could be very motivating. So yeah.
For sure, no, definitely. It was great to be able to see sort of where the data is going to and what's being made of all the data that's being submitted. I don't see any other questions rolling in through the chat here, so I'll keep my eye on it. But oh, sorry, one just came in. What are some of the big aspirations or hopes that your team has for using citizen science into the future?
Wow. I think the biggest aspiration is change the way we conduct population health research. I think that is the highest aspiration. Can we use citizen science in not just getting data, but also developing population health interventions? That would be the highest aspiration.
For sure, using that information right at the source to design some of those local solutions.
And I might want to add that another aspiration is not limiting ourselves to health or healthcare policy. There is one project that we are looking into at the moment where we are trying to understand the implications of climate change on potential mental health. And we are able to do that through ubiquitous tools through a citizen science approach. So that is again aspirational because we are cutting across different sectors and we are cutting across different disciplines in doing this work.
That sounds really, really interesting. I'll look forward to reading about that more as that project evolves. So I don't see any other questions coming in, so I think we'll move towards wrapping up. And before we do, we just have a couple of final notes to walk through. And before I do, I just want to thank you, Tarun, again for such an interesting presentation. It's got us thinking a lot about the future of technology and how this can really change the way that we do our work here in the health sector. I'll just actually maybe just leave this up for 1 second just to say that if anybody does have any follow-up questions for Tarun, please feel free to quickly write down his email address. He has given us the okay that if anybody wants to follow up, please feel free to do so. But I'll just quickly end off with a couple of final notes. So I think for those of you who are regulars on QI Power Hour, you've seen that we've really upped our game on this series with the highly coveted speaker gift of some iHeart Quality Improvement socks. So if you're a person who'd like to get your hands on a pair of these beautiful socks, we invite you to become a QI Power Hour speaker. So if you have a topic that you think our community of learners would be interested in, we'd love to hear from you. You can visit the link that Chelsea just shared out in the chat, and you can actually pitch us an idea for something you'd like to speak about. And so before we close off, we just want to invite you to join us next month for QI Power Hour, where we will invite Dr. Kevin Wasco and Sheila Anderson to talk about health networks in Saskatchewan. Health networks are collaborative teams of health professionals, including physicians and community partners, that provide fully integrated services to meet health needs of individuals and communities. Health networks are foundational building blocks of our health system and how we continue to advance the recommendations from things like the 2009 Patient First Review, the 2012 Primary Health Framework, and the Palin Report that recommended moving to a single health authority. So if you are interested in joining us for this session, we invite you to visit HQC's website where you can register. So with that, we'll say thanks to everyone for joining us here today. We wish you a safe and happy weekend and look forward to joining you back here soon. Thanks so much.